Nutrition for specific conditions. Tips for eating well when dealing with specific health conditions such as diabetes or heart disease. With proper food, frequent exercise, and weight control, diabetes can be effectively treated. If you have diabetes, it is advised that you consume a balanced diet rich in legumes and vegetables such as kidney beans, chickpeas, lentils, low-salt baked beans, and baked beans. Include some lean protein sources, low-fat dairy products, and high-fiber, low glycaemic index (GI) carbs such as wholegrain bread, cereals, and fruit. Choose foods low in sodium and cut back on added sweets and bad saturated fat. You can manage your blood sugar levels more effectively and maintain healthy body weight by reducing the serving size of your meals. It is advised that you consult a dietitian who can help you create a healthy eating routine that is ideal for you. Optimal nutrition and diabetes. Healthy nutrition can help those with diabetes better maintain general health, control your blood sugar levels, and reach your desired blood lipid, fat levels. Keep normal blood pressure. Keep your weight in a healthy range. Halt the progression of diabetes problems or slow their onset. Diabetes patients should follow the same healthy dietary guidelines as non-diabetics. You don't have to make specific dinners or buy particular items, so unwind and indulge in a nutritious meal with the rest of your family. Getting moving and diabetes. Physical activity is crucial, along with a good diet. Take on as many various forms of activity as you can. Aim to undertake at least 30 minutes of moderate intensity physical activity on most, if not all days of the week. Regular physical activity for a half-hour can reduce your blood sugar levels, reduce your blood pressure and cholesterol, lower worry and stress, boost mood and self-worth, get better sleep, and build stronger bones and muscles. If losing weight is your objective, try to exercise for at least 60 minutes most days of the week. If 30 to 60 minutes of exercise each day seems like too much at first, you can divide it into shorter blocks of 10-15 minutes and spread them out throughout the day. All adults, but notably those with diabetes, should engage in resistance exercise. You can develop a secure resistance exercise regimen with the assistance of an exercise physiologist. Try to engage in resistance training exercises at least twice a week. This might comprise body weight activities like push-ups, squats, or lunges at home using dumbbells and resistance bands like bands TM to do resistance exercises at home, hauling, lifting, or digging about the house, participating in weightlifting or other resistance exercises at a gym. Additionally, make an effort to spend less time sitting down at work, at home, or both. You can take on a few quick tasks to lessen the amount of time you spend sitting throughout the day, such as take the stairs instead of the elevator. Park further from where you want to go and walk. Take public transportation one stop earlier, then continue the journey on foot. Obtain up frequently, at least once every hour, to obtain a drink of water. Do some housework while watching TV, such as ironing. Play in the park with your kids or grandchildren. Instead of emailing your coworkers, get up and chat with them. Basic diabetic dietary recommendations. If you have diabetes, stick to a straightforward healthy eating schedule that includes eat frequent meals all day long. Make your meals main course veggies. When eating lunch or supper, try to fill at least half of your plate with non-starchy veggies or salad, as eating too much can result in weight gain and make diabetes more difficult to control. You might need to cut back on the portions of your meals and snacks. At every meal, consume a small quantity of high-fiber carbohydrates. Whole grain bread, cereals such as oats, Vita Brits, all-bran, and natural muesli, wholemeal pasta, brown rice, quinoa, fruit, and starchy vegetables such as corn, sweet potato, and potato are examples of foods high in fiber. Select low or reduced fat dairy products. Search for products with the least amount of sugar added. A wonderful option is Greek yogurt with fresh fruit. Choose skinless chicken and turkey, fish, eggs, legumes, beans, lentils, tofu, and nuts as lean meat substitutes. Limit your intake of foods that are high in harmful, saturated fats, such as full fat dairy products, butter, cream, fatty and processed meats, fried foods, cakes, pastries, and items that include palm and coconut oil. Instead, swap out unhealthy saturated fats for monounsaturated or polyunsaturated margarine, oily fish, avocado, seeds, and nuts, as well as beneficial unsaturated fats like olive, canola, or sunflower oil. Oily fish is excellent for the heart. At least 2 to 3 times per week, try to incorporate oily fish like salmon, fresh or canned, sardines, mackerel, herring, or tuna. Keep baked goods like sweets, cakes, and biscuits for special occasions. Avoid candy and sweet beverages including energy drinks, cordials, sports drinks, and soft drinks. Avoid adding salt while cooking or eating, and consume fewer high salt meals. Use spices and herbs to give your dish flavor. 2 standard drinks per day are the maximum you should have, with some alcohol, free days every week. Heart specialists typically discuss one of 3 types of prevention: secondary, primary, or primordial prevention. Similar aspects are present in all 3, but their beginnings and results differ. Second-line defense. These initiatives begin following a heart attack, stroke, angioplasty, bypass surgery, or the onset of another heart condition. It entails using drugs like aspirin and or a statin to lower cholesterol, quitting smoking, decreasing weight if necessary, increasing exercise, and eating a healthy diet. Secondary prevention is not closing the barn door after the horse has left, despite what the saying would imply. These actions can stop the progression of heart disease, a second heart attack or stroke, and early death. Although it may seem obvious, second heart attacks are the leading cause of death for people who survive a first attack. Primary defense. A person at risk for heart disease should practice primary prevention to avoid experiencing their first heart attack or stroke, needing angioplasty or another type of surgery, or acquiring any other form of heart disease. People who already have cardiovascular risk factors, such as high blood pressure or high cholesterol, are typically the focus of primary prevention. Primary prevention, like secondary prevention, focuses on reducing these risk factors through healthy lifestyle modifications and, if necessary, drug use. However, the emergence of concerning cardiovascular risk markers indicates that endothelial dysfunction, atherosclerosis, and or inflammation are already present and, for the most part, irreversible. Primordial protection. The term primordial denotes anything that has always existed. By focusing on preventing the onset of inflammation, atherosclerosis, and endothelial dysfunction, risk factors like high blood pressure, excessive cholesterol, excess weight, and ultimately cardiovascular events can be avoided. The American Heart Association's definition of perfect heart health and initiatives to assist people to attain it now places a strong emphasis on primal prevention, a topic that was previously infrequently acknowledged. Primordial prevention is exactly what its name suggests. The earlier you can begin practicing it, ideally from an early age, the more likely you are to succeed and safeguard yourself against heart disease. Important lifestyle changes can significantly lower your risk of acquiring heart disease and its associated risk factors. Quitting smoking. Tearing the cigarette to symbolize giving up smoking. Avoiding all forms of tobacco usage is among the healthiest things you can do. It can slow you down, make you sick, and shorten your life. Smoking is a hard habit to kick. It does this, among other things, by causing heart disease. Keeping an appropriate weight. Body mass, along with several other health issues, excess weight, and a big waistline are also risk factors for heart disease. Working out. Heart disease and many other diseases and ailments can be prevented with exercise and physical activity, but as we age, many of us become less active. One of the best things you can do for your health is to engage in regular physical activity. It reduces the chance of developing heart disease, diabetes, stroke, high blood pressure, osteoporosis, and some malignancies. It can also help older persons maintain a healthy weight, manage stress, sleep better, feel happier, and improve their cognitive performance. Real health improvements can be seen without training for marathons. For the majority of people, a brisk 30-minute walk 5 days a week will have significant advantages. Any quantity of exercise is preferable to none. If you liked this video, follow us and you will find many videos that will help you to transform your life. Thanks for watching all the video. Please subscribe and hit the bell. See you soon.